Yay. Okay. Janet, can you hear me better now? Whoops. Can you hear me better now? I switched to a completely different computer. Lots of you are joining in. Looks like you were able to find me. Yes, I don't sound like Satan anymore. I don't sound like a Jabberwocky. Okay, well, that's good to know. Sorry for that delay. You know, there's always some technical difficulties we have to deal with, but I appreciate your patience. Okay, so now I now have 3 computers in front of me, so I am at like my master computer panel. Hi, Charlotte. Hi, Janet. Thank you guys for bearing with me during the chaos. Okay, so now that I can no longer have technical difficulties, I'm glad to hear that you guys can hear me. Welcome everybody to this introduction to the TLS Select overview. Thank you, Dr. Mason, for confirming it sounds okay, and Janet and Charlotte and Lexi. It's great to see you guys all. We had about 25 people on the last broadcast. We lost some people. I'm guessing they're going to be joining us back in a few minutes now that the new broadcast is live. But I am so excited to see you all with me today for this Lunch and Learn. What I'm going to be covering with you today is, for those of you that were there at the update meeting on Wednesday night at the nutraMetrix division update meeting, I covered an overview of the new TLS Select program that we're launching. And I wanted to be able to provide a video of that, a recording of that for the people that weren't able to make it there, and for the people that were there but just want to be able to hear it again to learn more about the program. So what I'm going to be covering with you today is a little bit about what the TLS Select program is, why it was created, how it can be used in your business, and what tools you have access to help you implement the new TLS Select program in your health professional practices. So as I get started, I am going to look at my other computer since my presentation was on the other computer and I had to switch for the last broadcast, so I apologize if my eyes seem to go off in a crazy distance, but that's because my other computer is over there. But anyways, what we're going to be talking about is the fact that the TLS Select program is built upon the foundation that you already know and love, the TLS weight loss system. You see, our TLS weight loss solution that we've been offering through nutraMetrix for the past several years has worked wonderfully in hundreds, if not thousands, of health professional offices. And thousands of patients have been on the program and gotten great results that they love and results that they were able to maintain, because TLS, as you know, is not a diet. It's about learning a healthy lifestyle that can promote overall wellness for the long term. Now, why did we create the TLS Select program? We really created it for 2 reasons. First, we had health professionals that were asking for a way to customize the TLS program to their needs. And what do we mean by that? Well, some of the practitioners wanted to be able to create a wellness program that was branded as their program. So, for example, Dr. Smith's weight loss program. They didn't necessarily want to promote a branded program that was already created, that they had to follow step by step to the letter without any tweaks or changes or modifications based on their individual goals or their individual practice or patient needs. So we came up with the idea of creating a TLS Select program where the health professionals could select the components of the program that they liked and use it as a foundation to build a branded program for their practice. So think of it as if TLS, the program that you already know, is the foundation of a completely customizable program that each health practitioner can build upon and create for the needs of their practice and their patients. Okay, so what are the 4 key components of the TLS Select program? They're the same 4 components that you already know. It's low glycemic impact eating, body composition, teaching the patients that they need to move their masses, teaching their patients that it's not just about losing weight or losing numbers on the scale, but making sure that the weight that they're losing is fat. It's coming off in the terms of fat loss, not just lean muscle mass being lost. We're going to talk about the need for healthy supplementation and supporting the body functions as we go through the weight loss process, as well as providing education for the patients so that they know what they can eat, but they know what to do also in social situations. They know how to handle stress eating. They know how to determine what are their typical downfalls, what are their problems that created the weight challenges in the first place, right? So the 4 key components, again, just to summarize: low glycemic impact eating, behavior modification, supplementation, body composition. That's really what we're going for there. Now, With the TLS Select program, the health professional has the option of then wrapping around many other products and services or treatment protocols to the program as they're implementing that in their practice. And why would they need to do that? Well, there are some patients out there that have more weight to lose than what should be done without clinical supervision. So maybe a patient has 100 or more pounds to lose. Maybe they're clinically obese. Maybe they're severely obese. And maybe they have other comorbidity factors such as diabetes or insulin resistance that needs to be monitored by their practitioner. So when we talk about creating the TLS Select program, not only is it going to include the 4 key components of TLS, but the practitioners might add on to that some pharmacotherapy. They might have to put in some drug interventions, right? Maybe they need to add in behavior modification through intensive counseling. Maybe they need to add in a serious exercise program that is supervised under the guidance of maybe a physical therapist. Maybe they need to add in behavior therapy. There are many different facets that can be added on by a practitioner to the TLS program. That could also include adding in lab work, right? Maybe they need to look at hormone panels and see, is there any hormone dysregulation that needs to be addressed? Maybe they need to look at food allergy testing and see, does this particular patient respond poorly to certain foods that typically would be allowed on the TLS program? And because they're eating foods like gluten or dairy that they may be sensitive to, perhaps that could be one of the key reasons why that patient isn't responding to traditional weight loss protocols. Right? So the TLS Select program is built upon the 4 key components of our TLS program as we know it, but then the practitioner has the ability to customize the program by adding in ancillary services, ancillary products, ancillary medications, and they can create that program as a customized approach for their practice or for an individual patient. Okay, so let's talk about some of the things that you'll see when you read through the TLS Select materials. You're going to see an emphasis on body mass index, and that might be surprising to you if you have been, if you're well versed in the TLS system, because when we're talking about the normal TLS program, we typically don't address body mass index, right? Typically what we're looking for are body fat percentages or changes in body composition. So why is it that when we look to the TLS Select program that we address BMI? Well, the reason for that is we're talking about a clinical program that's implemented in health professional practices, and one of the markers that they look at when they're diagnosing a patient with obesity-related issues is that patient's BMI. So we couldn't ignore it. We had to address it. And for those of you that aren't aware of that, we want to make sure that you understand what a BMI means. Body mass index really is a way of measuring if a patient is obese or not in a clinical marker. And the way that they do that is if a body mass index is between 25 and 29, that patient's considered overweight. It's when the body mass index is over 30, between 30 and 34 is considered obese, and between 35 and 39 is severely obese. And then anybody with a body mass index of greater than 49 is considered morbidly obese. So when a practitioner is looking to see if a patient qualifies for obesity treatment, one of the markers they look at is BMI. We couldn't ignore that, so you're going to see that in our marketing and our training materials. Okay, so let's talk about why we created the TLS Select program when we already know that the TLS program worked in a practitioner's office. You see, you understand that we have patients that have done very well on the TLS program, but some of the patients need an additional level of clinical support. They need somebody that can work with them on a weekly basis or bi-weekly basis that can provide the education and the counseling for them, and that individual should be a health professional. That individual should be somebody that is an employee of the practices or employee of the doctor's office or the health professional's practice that's going to help monitor the patient. They're going to be taking their vitals. They're going to be working with them to monitor their medications. They're going to be really supporting that patient clinically. That's different than what the average individual does in the TLS program. Now, does this mean that practices should no longer offer the standard TLS program? Of course not. Each practice is going to have patients that may need to lose 5, 10, 15, 20, or 25 pounds, and that patient can probably do that in a self-guided study program using the tools and the materials that we provide for them through the standard TLS program. But the patients that need additional support, the patients that have maybe 50 or more pounds to lose, especially if they have 100 or more pounds to lose, they're going to need need that extra clinical support that's going to potentially require that clinical supervision. Okay, so how do we really recommend the TLS Select program happens? Well, the practitioner is going to customize each program based on the needs of their patients, based on the needs of their office, and based on the needs of the practitioners that they have. We recommend that the practitioner runs either a 12-week program, or if they're going to be incorporating detox into the program, that would be a 13-week program. But some patients might need the extra level of clinical support for less time than that. So the practice might want to offer a 6-week program in addition to the 12 weeks. So patients can choose between a 4-week program, if that's what that practitioner considers best for their practice, a 6-week program, or a 12-week program plus the detox. So all of this is going to be variable dependent on the needs and the goals of the practice. So typically we would offer, let's say we're going to go with a 12-week program for the sake of ease of explanation in this broadcast. What we would offer is the standard 12 weeks. It's going to follow the same guidelines as the 12-week TLS program that you know and love. It's going to follow the week-by-week lessons that are outlined on TLSslim.com. It's going to be, it has the option of being offered with or without the GeneSNP program for the practitioners that have access to GeneSNP. Why would we consider offering GeneSNP in the TLS Select program? Well, as you've heard on Dr. Mason's broadcasts in the past, and you're going to hear more about this in future broadcasts that she does, you're going to be learning about the fact that the GeneSNP program that we have is really based on an obesity test. Now, Dr. Mason has taken the test and she's looked at the SNPs and she's broadened it to much larger health implications, but the bones of it, the foundation of the GeneSNP program, is to look at markers for obesity. So of course that's going to be helpful for a practitioner to have access to the information that's found in that GeneSNP test. So practitioners can choose, are they going to offer the GeneSNP program with GeneSNP or without GeneSNP? And they would adjust the pricing for the program for the patient accordingly, whether or not that's included. We would also want the practitioner to look at some blood work. And in the materials that I'm going to provide for you on downloads, you're going to have access to a list of the sample blood work, the lab results that we might want to have a practitioner take a look at, or we might suggest would be helpful to a practitioner. Things like homocysteine levels, things like leptin levels, things like iron and ferritin levels, and total blood histamine levels. One of the things that we might want to look at as well is food allergy testing. We might want to look at hormone levels and blood glucose levels. So it's really going to be up to the practitioner what labs are included. We don't really have a say in that. The practitioner is going to practice medicine or practice their mode of healthcare in the way that they know how, but we're going to help guide them and say, these are the markers that you might want to take a look at. The beauty of the TLS Select program is that the materials that have been created do all of the selling for the health professional. Sometimes we've had health professionals say, I do really want to offer weight loss in my practice, but I don't want to feel like I'm coming across like a salesperson. And we understand that. So there's really no selling required with the TLS Select program. Basically, the way that it works is the health professional is going to have access to a 10 or 11 minute long TLS Select overview video that does all the selling for them. So here's how it can work in simple terms. A patient comes into the practice, they fill out the wellness intake form that we utilize in nutraMetrix. If the patient indicates that they would like to lose weight, that's going to be a clue for that health professional. We're going to talk to them about either the TLS program or the TLS Select program. Then that patient's going to go into the exam room and they're going to have the normal patient care visit. And as part of that patient care visit, the practitioner is going to discuss all the things that they would normally talk about with their patient. If the practitioner sees that the patient is obese or severely obese, they're probably going to indicate that the patient leaned towards the TLS Select program. If they see through the patient visit that the patient might have 20, 30, 40 pounds to lose, then that patient might do well just on the regular TLS program. It's going to be up to the practitioner. Are we going to recommend that that patient does TLS or TLS Select with the more clinical approach to it? But whichever one they decide, the practitioner is going to mark down on a piece of paper that's going to be given to the staff, this is the program that I recommend for this patient. That patient then can go to another room and they can watch an overview video. We have 2 of them to pick from, one for the standard TLS program and one for the TLS Select program. The video will provide the patient with an overview of what is included in the program and how it works. So the patient is going to leave their patient care visit, they're going to go into another room, they're going to quickly watch the video. When they come out, a staff member is going to say, were you interested in getting started with our weight management program? What part did you like best, or what part did you like least? Okay. Then, depending on the patient's answers, they're going to be given some marketing materials or educational materials that can help them make their decision. So what might they look like? And these are available right now in the download section of our nutraMetrix NC and HP support group on Facebook. They will also be added to the unfranchisedtraining.com website under the password protected area for NCs and HPs. But let me show you, I know it's kind of hard for you to see on the screen, but here is a sample of one of the tri-fold brochures that can be given to a patient. It's kind of hard to see because there's a glare. It's a beautiful sunny day here in South Carolina with 70-degree weather in the middle of February. Can't ask for anything better, but it might make it a little bit hard for you to see this. But you will be able to download these from the files section on Facebook as well as from unfranchisedtraining.com. But the point of this tri-fold brochure is that it explains to the patient the checklist of products that the practitioner might be offering to them. It goes through the 4 key components of weight loss that I mentioned to you and talks about the ancillary components that the practitioner might add. The health professional or their staff member can then check off the other materials or the other components that will be added to that practitioner, and it talks about how the patient can take control of their health with weight loss. Thank you for posting those brochures in there, Cecilia. I appreciate that. So those of you that are following along on the live broadcast, Cecilia just posted a link to this material if you would like to take a look at it. On the back, we also have some success stories and testimonials, and then there's a section here where the practice can put a little sticky note with the practice contact information. So the patient can walk away from this room or from the visit with something in their hand to review about what the TLS Select program is, and if they want to think about it, they have the materials to do that. Okay. In addition, the patient might be handed the 12-page overview brochure. This 12-page overview brochure, as I get all tongue twisted, is beautiful, and it walks the patient through what is TLS Select, what is included. It talks about the importance of maintaining stable blood glucose levels throughout the day. It talks about the importance of detox. It talks about what the person would eat if they follow the program, and it goes through and talks about how many servings of what with the approved food list, gives them some sample menus, because one of the things that we found is when people are considering a weight management program, they want to know what they'll be eating before they can even decide. They need to look at this and think to themselves, can I do this, right? So this brochure, this 12-page overview, helps them come to the conclusion, this is easier than most people think. I can do this. Then it goes through and it talks about the healthcare professional and what they're offering and why supplementation is necessary, and it gives an overview of the support tools that are available. So you're going to make sure that you download those documents so that you can read through this and that you're familiar with them. But going back to the flow of how it can work in the office, so the patient came into the exam room, they had their normal patient care visit with their health professional. They then indicated in one way or another that they were interested in weight loss. Depending on how much they needed to lose and how much support they need based on that patient's medical history, the practitioner is going to determine whether it's going to be the TLS program or the more clinically advanced TLS Select program. The practitioner is going to send them to another room where they watch one of 2 videos. At the end of the video, they're going to be taken by a staff member and determine, am I ready to start? Or do I need to think about it? They're going to be given the marketing materials, and those that are ready to get started will be enrolled into the upcoming 12-week program or the upcoming classes. Those that said they need to think about it, it's going to be noted on their chart, and then a staff member may follow up with them in the near future to say, when you were in the office last week, you indicated you needed some more time to think about it. Have you thought about it, or what can we do to help you get started? Something like that. Okay, so then I want to share with you some of the other tools that were created that you'll find on downloads that were very helpful. One of them is an 8-page flow chart that looks like this. It's a PowerPoint presentation, and it walks you through the process that I just explained to you. Patient check-in, they're given the wellness intake form, they go into the waiting room, they see TLS marketing materials there, they have their care visit with the practitioner reviews their wellness care intake form with them, and then sends them off to see the video. Okay, then these flow charts can also be outlined on recommending additional nutraMetrix products like OPC3 or NutriClean Fiber Powder or Heart Health Omega-3. The same process can work. It's really the implementation flow that we teach in the nutraMetrix consultant training, but we've added in the flow charts that talk about sending them to watch the video that overviews the TLS program or the TLS Select program, and then enrolling them into whichever of those two programs works best for them. So there are 8 of these slides that walk you through each of the implementation steps. So you want to make sure that you've gone through that process so that you can help your health professionals and your staff members get up to speed on what the process is. Some other guides that we have available for you is the pricing of the TLS Select program is also completely customizable for the practice based on the products and services and ancillary materials that the practitioner has chosen to include in their TLS Select program. We give you an overview of suggested pricing, but I want to just preface that whenever you see suggested pricing with the TLS program, you want to make sure that you understand that is just a suggestion. Each health professional is going to determine what they want included in their TLS program. They're going to determine how many office visits are incorporated. Are there medications incorporated? Are there lab tests incorporated? And of course, there are costs associated with all of those things. So the pricing is going to be customized based on what is selected from TLS Select to be implemented in that particular practice. Let me share with you some sample pricing, and I'll put these as slides up in the Facebook group as well. I'll also put these on downloads. But let's say, Dennis Franks has been piloting the TLS Select program for the past almost year with several health professional practices around the country. And the pricing that they decided that they were going to work on, and this is just a sample, it can be, each practitioner can charge more or less depending on what they want to include. But for practices that were offering GeneSNP as part of a 12-week program for TLS Select, they were charging about $2,499 for the full 12-week program, and I'll explain what was included in that. Now, keep in mind, GeneSNP by itself has a suggested retail of $495, right? So that $2,499 includes a suggested retail of a GeneSNP program. If a practitioner is not going to be incorporating GeneSNP into their TLS Select program, then that same program could be offered for about $1,900 because we've deducted the cost of the GeneSNP itself. So what might be included in a program that's going to cost $2,400 for the patient over 12 weeks? Well, that would include all the supplements and all the materials for the 12-week program, and I'll explain what those are. It will include weekly counseling with a staff member that is now called the Wellness Coordinator as part of the TLS Select program. The Wellness Coordinator is the individual who is either a health professional themselves or works in the health professional's practice and is going to handle the clinical care of that patient under the guidance of the health professional if it's a staff member. And I just want to talk about this for a second. I know that many of you that are NCs in the past have been doing some of the TLS coaching in your health professionals' offices yourselves. If you are not a health professional yourself, you should not be doing the wellness coordinator role in a health professional's practice. We're talking about patients who have unique clinical needs. We're talking about patients who have comorbidity factors with obesity. We're talking about patients whose blood work needs to be monitored closely, whose medications need to be monitored closely. And the average NC is simply not qualified to be the wellness coordinator in a TLS Select practice. So I'm going to stress to you again, the wellness coordinator, when we're talking about implementing TLS in a health professional's office, should be either a health professional themselves or a staff member that's working closely under the guidance of the health professional in that office. So I just want to clarify that with you. But the wellness coordinator, we're going to make sure that they get compensated for their time by building in coaching fees to the package price of the TLS Select program. So in this case, we recommend building in $30 an hour for the wellness coordinator per patient. Now, if the practitioner is going to have the wellness coordinator meet with the patient each week for 12 weeks. Then we're going to build in an hour a week with that wellness coordinator. Now, this is going to be done in a group setting, but it'll be $30 per hour for the wellness coordinator per patient. Again, this is just a suggestion, but you'll see that in the marketing materials that I'll put up for download. So we're going to include, again, in that $2,400 estimate that I just gave you, it's going to include all the supplement and material hard costs. It's going to include $360 per person, which is $30 per hour for 12 hours for the wellness coordinator. It's going to include in the hard cost of the GeneSnip if GeneSnip is being implemented in this TLS Select program. And it's going to include in the cost of the TLS subscription for the patient on the TLSslim.com website. So what products are included in that? How did we get to those numbers? I see there's lots of great activity going on in the chat, and I want to thank Lexi and Dr. D for answering some of the questions as I'm talking. I will go back through and see if there's any questions that still need to be addressed at the end of the segment, so keep typing those questions in. And thanks again, Dr. D and Lexi, for answering some of those questions along the way. But the products that we included in the sample pricing that I just reviewed with you, keep in mind this is a 12-week program, so that's 3 months, right? So we included 3 bottles of the TLS Core. We included 6 bottles of the TLS Nutrition Shakes or canisters because they're going to be eating or drinking shakes every day as part of their healthy snacks. We included 1 health guide and health journal. We included 90-day serving of the Isotonics multivitamin. We included 2 bottles, because we know most people take more than 1 cap a day, of OPC3. And we included 1 bottle of the Isotonics Advanced Activated B Complex, as well as that subscription for 3 months to TLSslim.com. So that's where all the hard costs are coming from, okay? Now, as you go through those materials, again, keep in mind the costs are going to be customized, but you want to make sure that the practitioner is going to see this as not only a great program for their practice, but they're going to see it as a profitable program for the practice and a program that is self-funded. So you want to make sure that if they're going to have a staff member dedicate time to the program, that the cost of paying that staff member is built into the package price for the patient. I'm losing my voice, so I needed to take a little drink there. Apologize. So when you're working on when you're working with practices on customizing the pricing, what do you do? How do you put that all together? Well, let's go back to some of the tools that are created for you. We have put together some pricing options or pricing guidelines for you that are available on downloads. These are designed to help you as a guide so that you don't forget components when you're pricing it out. So it includes in there, you're going to determine what's the length of the program. Are you going to offer it for 4 weeks, 6 weeks, or 12 weeks? How many visits are going to be included with the wellness coordinator as part of that? What supplements are going to be included and how many are going to be included for this particular period of time? So if you're doing something for 12 weeks and the supplement only comes in a 30-day supply, you're going to need to multiply that by 3 because they're going to need 1 per month for each of the 3 months. So just don't forget to do that. This helps you work through the math of coming up with your hard costs. And then what additional supplements are going to be included, because we have the TLS supplements here, but you may want to add some additional supplements like the multivitamin, digestive enzymes, fiber powder. What does that practitioner want to include in the use of the different supplements with their program? Then where are the provider visits going to come in? How many times are they going to actually see the health professional themselves? And what special programs are going to be included? Let me bring this back over here. So is there going to be intensive counseling or lab visits or physical therapy or physical activity? Is there going to be behavioral activity? Is there going to be pharmacotherapy? Is there going to be a detox included? Is the GeneSnip going to be included? All of this can be included on working out your price. This is designed, again, to help the health professional come up with what are the hard costs so they can determine the overall program costs. And you'll notice there are 2 of these forms. There's one if you're implementing TLS, and there's one if you're implementing TLS Select. The same concept applies to both. Once the hard costs have been determined and the overall program cost has been determined, then there's pricing options that go to the patient as part of that initial overview after they've watched the video so that they can explain to the patient where the costs are. It's helpful to package it as one specific cost for the entire 12-week program or 4-week program or 6-week program. So this is what the document looks like that the patients are going to see. It's going to say, okay, the doctor or health professional can just check off. You're going to have the 4-week program, the 6-week program, or the 12-week program. There's an overview of what the program includes, and then a cost can just be written here on one line. There's one of these for TLS, and there's one of these for TLS Select. So depending on what's being offered in the practice, you would choose the appropriate form for that. And the final tool that we have available for you on downloads is a customizable Meet Your Wellness Coordinator form. It's helpful when the patients are deciding whether they're going to participate or not to know who they'd be working with over the course of the 12 weeks. So this form was actually created in PowerPoint, so it's easily editable. You'll see here that this is just a stock image, but what would go here in place would be the photograph of the actual wellness coordinator for that practice, and then they can type in their name, their education, their bio, any specific interests, and all of their social media profiles and contact information can be there. So the patients get to see who they'd be working with as their wellness coordinator as part of the 12 weeks. Okay, or maybe 4 weeks or maybe 6 weeks, depending on what that practitioner decided to offer. So those are it's an overview of the tools that are available to you. I'm also going to put into the Facebook files and the downloads of unfranchised.com the slides that I used at the division update meeting at World Conference that explain everything that I just went through this with you. I see lots of questions in there about, is this session being recorded? Yes, this session is being recorded, and it will be available on Meet-On later today. So I know some of you have colleagues that were not able to watch it today that wanted to see this, and I know some of you want to be able to watch it again. Sometimes you need to hear things a couple of times before it really sinks in, and that's totally normal. 7 different times, 7 different ways from 7 different people is how we tend to learn the most. So you will be able to come back and watch this recording as often as you need. The best way for you to learn, however, is going to be for you to download the materials and go through them yourselves, and then write questions in the Facebook group if you're a member of the Facebook group, and we'll be able to provide answers to you on that. We also have 2 trainings coming up in the month of April where we will be talking about this both on the NC side of the training and in the health professional side of the training. We have the first weekend of April. We have a training in Cherry Hill, New Jersey, and the weekend immediately following that, we have one in St. Petersburg, Florida. Both weekends have a nutraMetrix consultant training and a health professional training going on simultaneously, and the TLS Select program will be covered in depth at both of those courses. So for those of you who need to renew your nutraMetrix consultant status and you're up for renewal soon, we'll be covering this at all NC trainings moving forward. We will continue to provide you with information and updates on Meet-On, as well as potentially doing some additional webinars for those people that need them. My purpose today in giving you this overview, though, was to give you an idea of why the program was created. We wanted health professionals to create a program that can be branded as their own, that can include not only the foundation of the TLS services and programs and products that we already have in place, but can be expanded to include lab work and additional materials and tools that the health professionals want to be able to use as they create their own branded product line, not product line, but their own branded weight loss program using the nutraMetrix TLS product line as part of the foundation. So that's really why we created the program. We also wanted to be able to give them flexibility in guidance on how to incorporate the program into the practice. Now, this will come to the question, and I see this is being answered now by Dr. Mason. A lot of people will ask, is this program billable to insurance? Is it a reimbursable program? And let me just start by saying, you don't want to go out and sell it as an insurance reimbursable program. And the reason for that is because whether or not it is covered by insurance depends on multiple factors. First of all, is the health professional that is implementing the program able to bill for weight loss? Many health professional types are not able to bill for weight loss based on their scope of practice. So for example, massage therapists would not be able to bill for weight loss services. But if you're talking for somebody like an MD, is it part of the scope of practice of their specialty to be able to bill for weight management program? That's going to be up to the practitioner's scope of practice, the specialty of the practitioner. It's also going to depend on the health insurance plans that they participate with. But then in addition to that, the patient's medical condition or the medical history is also going to come into play there. So there's multiple factors: the scope of the practice of the practitioner, the type of plans that the practitioner participates with, as well as the health of the patient. If a patient only has 10 or 15 pounds to lose, there's no way that they're going to get any type of weight loss services covered by insurance. Now, if they're clinically obese or morbidly obese, they may be able to get portions of the program covered by insurance. The supplements will most likely never be covered. The gene snip test will most likely never be covered. However, the physician visits, part of that could be covered based on those things that I just talked about with you. The lab tests, part of those could be covered based on the things that I just talked about with you. But it's really going to vary from practitioner to plan and to patient. So you don't want to go out and sell the program as an insurance reimbursable program, because there's just too many moving parts to that for us to be able to guarantee it as insurance reimbursable. So hopefully that helps answer that question. So that's what I wanted to cover with you today. Now let me go back through some of the questions and see if there's anything that I need to address that wasn't already answered by Dr. Mason or Lexi or some of the other attendees in the chat. You guys have been asking a ton of great questions. So let me just hear. So it looks like most of the questions would be answered. Okay, somebody asked a question. Would you recommend that a health professional post a job posting to hire a nutritionist or RD if their staff is already swamped? And I think that's really a great idea. I think one of the key components to success of the TLS Select program is that there's a dedicated person on the staff that can handle the weight management program in that practice. And sometimes that means bringing on a new person, even if it's part-time, as a staff member. The beauty of this is it's a self-funded program, because sometimes when people have asked me in the past, should I bring on a staff member to implement nutraMetrix in my practice? The question is, are you going to move enough of the product to warrant the hiring expense of bringing a new staff member on? This already has $30 an hour per person built into the program. So if you, let's say, for example, the practitioner is going to run a group with 10 people in it at $30 an hour, that's $300 per hour that's being generated by the TLS Select program with just 10 patients participating. That should be more than enough to hire a practitioner to come in and help implement that program, because again, that's just one group of 10 people. And if the practice is truly going to be committed to implementing the program in their practice, they're of course going to have more than 10 patients that are participating in this program. So it can self-fund hiring a staff member that's qualified to implement as the wellness coordinator in the practice. So somebody wrote, I thought it was private sessions, one-on-one for $30 an hour. It could be private sessions if that's what the health professional wants to offer. We do find that in most cases that the practices are going to create group counseling sessions where they get 10 or so patients together in a weekly session. However, they may do private one-on-ones in between there, maybe on the first week, the 6th week, and the 12th week to address patient questions. Remember, this is just a guideline. The practitioner can set up the program exactly how they want it in their office. There is no one-size-fits-all implementation of TLS Select. Everything about TLS Select is going to be completely customized for that individual practice. So it looks like, other than that, most of the questions had been answered. I greatly appreciate everybody's time today. If you do have additional questions, please make sure that you're a member of our nutraMetrix NC and HP Facebook group, and you can address your questions in there. You can also send them via email to nutraMetrix@nutrametrix.com. We look forward to seeing you on future broadcasts. I just published today a Meet on Broadcast calendar that takes us through the middle of April that has almost a meet on per day on it. So it is our goal to have tons of additional education and options for you to be able to learn about nutraMetrix and all of the programs we offer through nutraMetrix, whether that be GeneSnip, whether that be TLS Select, whether that be TLS, whether that be all the different products and services that we offer. So please keep your eyes out for the Meet On calendar, and we look forward to seeing you on as many broadcasts as possible. Have a great day, guys. I really appreciate you joining me today. Thank you.